Successful BVM ventilation requires technical competence and depends on four things: a patent airway, an adequate mask seal, proper ventilation technique, PEEP valve as needed to improve oxygenation. Ventilation of the patient is the most important part of the process of intubation. If you can ventilate, then an inability to intubation becomes less of a problem. You can continue to ventilate, thereby supplying the patient with the much needed oxygen, whilst you either seek further options or further help.
Which size ventilation bags may be adequate for 2-month-old infant to support effective tidal volume? Resuscitation bags used for ventilation of full-term newly born infants, and children should have a minimum volume of 450 to 500 milliliters. Fine. Which types of ventilation bags? Manual resuscitators. Do you know? There are two basic types of manual resuscitators: ventilation bags, self-inflating and flow-inflating resuscitators. Which types of manual resuscitators? Ventilation bags. Do you prefer for resuscitation? I prefer self-inflating bags. Flow-inflating bags, also called anesthesia bags, are more difficult to use. They should be used only by trained personnel. Regardless of the size of the manual resuscitator used, the rescuer should use only the force and tidal volume necessary to cause the chest to rise visibly. What is the effect of excessive ventilation volume and pressures? They may compromise cardiac output by raising intrathoracic pressure, distending alveoli and/or the stomach, impeding ventilation, and increasing the risk of regurgitation and aspiration. In the patient with a head injury or cardiac arrest, excessive ventilation volume and rate may result in hyperventilation with potentially adverse effects on neurological outcome. What happens when the valve in ventilation bags is not working properly? High pressures may be required during bag mask ventilation of patients with upper or lower airway obstruction or poor lung compliance. In these patients, a pressure relief valve may prevent delivery of sufficient tidal volume. When you have a problem, you should resolve that problem. Bag mask systems used for resuscitation should either have no pressure relief valve or have a valve with an override feature to permit use of high pressures. We will continue tomorrow. Thank you.